Hello, this is going to be a vlog, just giving you some guidance as to how to do your task 1, 2 and 3 in health promotion on the HND diploma. The first thing to do before starting your assignment is just to be clear of the expectations in the module handbook. So really making sure you know what the learning outcomes are, making sure you know the assessment criteria, as well as the criteria for the pass, merit and distinction. When starting each of your tasks, you really need to make sure that you are familiar with the core book, which is suggested in your module handbook, the Evans edition, the third one, Health Promotion and Public Health for Nursing Students. So in here you've got all of your the chapters, you've got the index at the back. Throughout the module handbook there are week by week suggestions as to what chapters you need to read to make sure you understand what's required of you for each lecture. So I know we are coming towards the end of the module and it's my first module here at the college, but please do make sure that you are familiar with this book, the chapters, as well as the index at the back. So if there is something specific you want to read, just please be familiar with the back bit and it will break down which page you need to look at. So this is a really helpful book which will help you enormously throughout the module. So this afternoon you will be doing your presentation for task 1 for the health promotion. So most of this should be done by now because you'll be presenting to me and Finola. Good luck, by the way. So this vlog is really just going to break down what you need to do for task 2 and some of task 3. I've given lots of guidance on task 3 and will continue tomorrow and the week after. So really a lot of this video will lean itself towards task 2, which is about 1,000 words report, maybe increase slightly, which will I'll let you know soon. So here we go. So for task 2, you are it will be helping you with learning outcome 2 and some of 3 as well. So learning outcome 2 assessment criteria 2.1, 2.2, 2.3, 3.1, 3.2, 3.3. So here we are, you've got the outcome and the grid here, so please just check this in your module handbook if you're a little bit unsure. So it's this one and this one here. Okay, so for learning outcome 2, you will start off by analysing. So please make sure you understand what analyse means when doing this. So you'll be analysing the links between government strategies and models of health promotion. And the rest of it will be more of an explanation and discussion that you'll be doing. So just be mindful of the first part of the task you'll be analysing. So this is where we get quite critical and we're taking things apart when different pieces of information. So it's really important to be mindful of what that means. So here we go. So what we'll be doing is we'll be analysing the different models of health. So you need to be aware of the health belief model, the medical model, the social model, and there's various other models that we've been looking at. So you may want to just analyse what those models are and how they obviously how they work in practice. So there's lots of information in the Evans book there again to look at. So analyse what those different models are, obviously critiquing them when can. And what you need to do once done that is you need to be looking at the government strategies, which is what's required for 2.1. So you'll be basically saying what is the link between the government strategy and the models of health. So how does the Sure Start centres fit in with some of these models above, which was set up through the New Labour scheme in 2004 then on. You've got obviously Every Child Matters, which was introduced for the Green Paper. More recently we had the Marmot Review strategy, which is obviously revised, say, introduce the 6 outcomes which people we need to achieve to eradicate inequality. So link some of these strategy policies to the actual models and say where do you think they would fit, where would they not. So it might not necessarily be a complete tight fit, you just need to just be mindful, these are theories, these are some of the government strategies, this is what I think it's trying to take the stance from. So there are lots and lots of government strategies here. So as you can see, Sure Start, Every Child Matters, Marmot Review, Strategic Health Direction for Health Services and the Justice System. So that government strategy will suggesting lots of guidance to health professionals in making sure that adult prisoners, children prisoners and older people, especially people with disabilities, are being supported. So you have got that policy in your folder, so please just look at that and think, okay, I think this is taking the health belief model or maybe the social model perspective. We've got the Public Health Act 2006, Smoke Free England. Okay, so various lots of different strategies there, so just please be mindful of them and try and incorporate them linking to the model. In addition to 2.2, you've got to explain the role of professionals in meeting government targets for health promotion. So what are the different targets that have been set for professionals in terms of obviously promoting health promotion? So for example, if you look at some of the Healthy Lives, Healthy People 2010, there were lots of guidance there suggesting what professionals need to do. So one of the key things it was suggesting is that it's about creating, let me look, so it's looking at the key issues between inequalities in health, providing educational, financial and social support for healthy choices. Okay, so it wasn't necessarily a target in itself, but it was a topic for professionals to work together. And prior to that, you've got the Choosing Health 2004, which is about trying to reduce the number of people smoking, obesity and targets. So lots of targets about trying to make sure that people are promoting much more better health. So like weight loss, people smoking. So I think we have achieved that really well. There's been a huge reduction of people smoking. So you might want to spend a bit of time looking at that and looking at how that's a great step forward. But obviously in terms of obesity, that's still a big issue which we're still having to work with. Some other little measures in terms of looking at what nurses need to do. We can see here we've got you've got your screening. It's about nurses working with charities a lot more, given that we've gone through a recession. So charities are a really good source of support for professionals. So it's about making sure as NHS staff we're mindful of that and we are actually working with them, referring patients to them, especially if you think there's not much resources you are offering as a public sector. We've also, as well, we've got, we've seen a big push on family nurse partnerships, so maybe for teenagers who are pregnant. I know a family nurse practitioner will want to go visit them to make sure they're supported, so that's another target. It's about using that, pushing that. Double the number of health visitors we've seen, but the Change for Life campaign, and also about eradicating child poverty by 2020. That was a big push. Has that been met? I'll let you think about that. Okay, but there were some of the big targets and goals which as health professionals we needed to be mindful of. Another one as well, the 5-year